The shift from using search engines like Google to using conversational AI like ChatGPT for health information represents a significant change in how people access medical information. Understanding the differences helps evaluate the implications. Traditional search engines return ranked lists of sources, websites, articles, medical databases. Users see source URLs and can evaluate credibility. Academic papers, government health agencies, and established medical institutions typically rank highly. The user reads multiple sources and synthesizes information themselves. The process is transparent about where information comes from. Conversational AI synthesizes information across its training data and presents conclusions without necessarily providing source provenance. You get a coherent, natural language answer to your question, but often without citations or links to verify the information. The synthesis can be valuable. AI can integrate information across multiple sources and present it clearly, but lack of sources makes verification difficult. You're trusting the AI's synthesis rather than evaluating sources yourself. This is more convenient, but less transparent about information quality and reliability. The conversational format allows context retention and follow-up questions that search engines don't support well. You can have a multi-turn dialogue where later questions build on earlier ones. This makes complex health questions easier to explore. But it also means you might spiral deeper into one line of inquiry when you should be broadening your search or verifying against other sources. Search engines naturally expose you to diverse perspectives because you see multiple results. Conversational AI provides one synthesized perspective, which might be balanced or might reflect biases in training data. The synthesis versus sources trade-off is central. Synthesis is valuable when information needs to be integrated across multiple specialized sources. AI can explain how different pieces of medical information relate to each other more coherently than a list of search results. But synthesis without source transparency creates problems. You can't verify whether the synthesis is accurate. You don't know if AI is equally weighting high-quality medical evidence and questionable internet sources. You can't check for updates. The information might be based on outdated sources. Hybrid systems that combine AI synthesis with clear citations and source links might offer the best of both approaches. Imagine an AI that provides conversational summaries while displaying cards or footnotes linking to each source used in the synthesis. Users get the convenience of coherent explanations while retaining ability to verify information against primary sources. This would require changes to how AI systems are built and how they present information, but it's technically feasible and would significantly improve reliability and user trust. The recommendation quality differs. Search engines returning medical sources often surface high-quality information from academic journals, government health agencies, and medical institutions. The problem is presenting this information in overwhelming, technical formats that non-experts struggle to understand. AI can explain complex medical information in accessible language. The problem is that without source links, users can't distinguish high-quality synthesis based on medical evidence from plausible-sounding explanations based on unreliable sources or hallucinated information. User experience differs markedly. Search requires more effort, scanning results, opening multiple pages, reading and synthesizing across sources. Conversational AI is easier. Ask a question, get an answer. This convenience drives adoption, but might reduce critical evaluation. When information comes easily, people may be less likely to question it or verify it. Cognitive effort often correlates with critical thinking. The friction of traditional search, while annoying, potentially encourages more careful evaluation of information quality. AI's ease might promote passive acceptance of whatever it says. For health information specifically, source credibility is particularly important. The stakes of acting on inaccurate health information can be severe. The trade-off between convenient synthesis and verifiable sources is especially acute in this domain. A reasonable middle ground might be educating users that AI is good for initial understanding and organization of health topics, But important health decisions should involve verification through primary sources and consultation with healthcare providers. AI provides the first pass, search helps verify, and professional medical guidance makes final decisions. The evolution of these tools will likely continue blurring lines. Search engines are adding AI features that synthesize information. AI tools are experimenting with source citations. The future probably involves hybrid approaches that combine conversational convenience with source transparency. The key is ensuring users understand what they're getting. Is this verified medical consensus, general understanding from diverse sources, or AI's best guess based on limited training data? Different queries require different levels of source rigor. Casual health curiosity can rely on AI synthesis. High-stakes health decisions require source verification and professional guidance.